it doesn't just happen to other people. You could be at risk for a pulmonary embolism. It's a clot that lodges in the lungs but originates somewhere else.
The majority of those are blood clots that break off from the legs and then travel up the body through the heart into the lungs.
Clots in the legs are called deep vein thrombosis, or DVT. They're one of the most common sources of pulmonary embolism. Being laid up in the hospital is one risk factor.
Because patients come in and they're bed-ridden and they're sick and they're not moving around that much. So the hospital actually has a lot of protocols in place to prevent this.
Sitting in the car for hours or on a long plane ride also elevates your risk. Again, it goes back to mobility, and again, there are things you can do to lower your risk.
If you're going on a car ride, it's always a good idea. Just stop every couple of hours, get out, walk around the car a couple of times, and then get back in. Just that little mobility keeps the blood flowing in the veins and will help lower that risk. And if you go on a flight, doing little calf raises that help keep the blood circulating.
A prior surgery, poor circulation, peripheral vascular disease, smoking, obesity, and pregnancy can predispose people. Symptoms may mimic a heart attack.
The vast majority get the symptoms of shortness of breath, they can't breathe, they're very winded, low blood pressure.
These should prompt you to see a doctor immediately. Cases of pulmonary embolism are usually treated with blood thinners. Severe cases may need clot-busting drugs. The point is to know your risk factors, and if you suspect a clot, call your doctor. For Lee Memorial Health System, I'm Amy Osher.